everybody. I'm Namita Thapar, Executive Director of MCure Pharmaceuticals, and welcome to another fun episode of Uncondition Yourself. Today we have with us a very dear friend and someone I absolutely look up to, Kiran Mazumdar Shaw. She is the chairperson of Biocon. She is Padma Shri and Padma Bhushan, a self-made entrepreneur for over 40 years and has won the prestigious E&Y Entrepreneur Award and in the list of one of the topmost philanthropists in India as well as globally. So today we're looking forward to hearing her insights, her guidance and her outlook on women's health in our country. So with that, Kiran, thank you so much for joining us today. I know what a crazy life you lead and you've spared the time to come and talk to us and inspire women on the show. Thank you very much.
Well, Namita, it's always such a pleasure to see you. I've been listening to these episodes of yours and I must really commend you on bringing this whole thing to the fore, because I really think women's health needs, to be brought into the fore, to be talked about, because I think for far too long, women are not even talked about when it comes to healthcare needs. And I think women themselves take it for granted.
In fact, that's a great segue, Kiran, to my first question, because you rightly said that, women in India don't very often have a voice and most importantly, don't prioritize themselves in general because of societal biases and most importantly, when it comes to their health. So very often we see that women don't go for their annual checkups and so many conditions go undiagnosed. So how do we change the mindset in our country when it comes to women prioritizing their health?
It actually has to do with our culture. I think women see themselves as caregivers and they don't necessarily see themselves as caring for themselves. So I think that itself has to, change in terms of a mindset. I think women do need to understand that unless they look after themselves and their health comes first. So prioritizing their health is extremely important when they want to provide for others. So I think that awareness has to be basically built up. Secondly, I think, all of us are guilty that, we don't go for regular checkups, we take things for granted. And I don't think this is just about women, I think even men do that very often. Right. But I think women have to actually prioritize healthcare because they know that they have such an important role to play in raising their families. They are the anchors of their families when it comes to healthcare and caring for families. As an entrepreneur and as a philanthropist, I've actually looked at various aspects of women's health. And of course, being very focused on cancer, we know that many women's cancers can be prevented altogether, right, or can be treated and, they can be cured if detected early. And if women know that they don't have to dread this disease, if they actually detect it and diagnose it early enough,
it's preventable.
So that it can be not just prevented but treated and cured.
Right. Right.
So I think those are some of the things that we need to bring some emphasis on. I know that I've helped a lot of startups who've come up with these very interesting smart diagnostics, whether it is non-invasive diagnostics, whether it is handheld devices that can do things which otherwise needs to be done in sort of radiology departments of hospitals. I think these are some of the things that we really need to think about. I supported a young entrepreneur who developed a handheld mammogram. And that was such an easy way of, diagnosing or detecting any lesions in the breast. And it was very easy to do. It was like a 10-minute procedure, which otherwise would take you a long time. And, a typical mammogram almost puts you off. You don't even want it's a dreaded diagnostic. So I think these are some of the things that technologies are helping us with today. And today we know that there are a number of new technologies that with a simple blood test can tell you a lot about early detection. So I think today we need to actually bring a lot of innovation in diagnostics and affordable diagnostics, because obviously you can't afford a diagnostic to be very expensive in our part of the world. And when women basically realize that it's a simple procedure, they don't have to be scared about it, then I think people will come forward and get themselves tested and, you know, go through with a regular checkup much easier than before.
But isn't all this just a drop in the ocean? I mean, it just seems like there's so much that needs to be done. Are these startups enough? Are they getting enough funding? Do they have access to rural India where it really counts? How do you see that landscape panning out?
So actually, many of these diagnostics that I'm talking about are very effective in rural areas, because, you know, rural areas is where...
But are they reaching rural areas?
Yeah, they are. Actually, they are. And I would say that a lot of health camps are being conducted at primary health centers to do much of this. But I think the fact is that when you talk about rural health and rural healthcare, state governments have to fund these programs. And if they don't fund these programs, then obviously it just becomes like a pilot initiative which never gets scaled up. I think our biggest challenge in our country is scaling up technologies. And the scaling up can only happen if public health is a big focus.
Funding.
And it's not about funding so much, it's really about state governments investing in healthcare. So if you don't invest in early diagnosis, for instance, and if you're only going to focus on treatment, that's where the problem is.
Absolutely.
Okay? We focus on treatment, by which time it's too late. And then the cost of treatment becomes huge.
Right.
But if you actually diagnose early and you treat early, the outcome is better and the treatment costs are much lower.
Absolutely.
So I think that's where we need to focus on.
You're absolutely right that the cost of treatment is so much more than if we had diagnosed it early. And of course, the burden it puts on our already limited infrastructure. Because when we compare to the developed world, whether it's a doctor to patient ratio or the beds to patients, those numbers are pretty dismal and shocking too, wouldn't you say?
Yeah, and we spend less than 2% on healthcare in general. And you know, for any LMIC country, we should be double of that.
Yes. So Kiran, I know you're involved a lot with government policy shaping, also with the Lancet Commission. So what can influencers like you do to change the situation, whether it is a lot more diagnosis needed or funding, like you said?
So, you know, the Lancet Commission that I'm involved with is very interesting, because the whole, initiative is called Reimagining India's Health System. And I think here we are looking at various aspects of our healthcare ecosystem. So, for instance, what should be the financial modeling around paying or supporting or reimbursing healthcare? That's one question. The second question is human resource. You know, you just mentioned that there's this huge, flawed ratio, imbalanced ratio that we have between doctors per 1,000 patients or people, or nurses, or even hospital beds and what have you. So that's one big, challenge we have. How are we going to solve that? Then we have this whole thing of technology and what role that can play in healthcare or transforming healthcare. And then the other aspect is really about a citizen's aspect of governance. You know, we keep doing things top down. How do we engage citizens to be very much a part of the solution? Rather than always kind of creating the problems or the problem statements. Can we engage with citizens to be part of the solution?
How can that be done?
So things like awareness, things like checkups, things like making sure that the citizens know why healthcare is important. How do we fund and bring awareness on women's health, right? We, of course, there is a huge emphasis on women's health, because we know that when it comes to public health, maternal health care, infant health care, making sure that we focus on these aspects of healthcare is also very important, because ultimately the healthcare success of any country depends on maternal health and child health. And we know that many of these issues that we talk about, whether it's the 1,000-day, tracking of the infant in terms of health,
Right.
or whether it is the pregnant woman and how we trace her pregnancy and make sure that she delivers a healthy baby. All this is very important, and I think these are very important aspects of women's health.
Technology can help because you have so many of these apps and digitization which can help in this level of tracking and awareness like you speak about, right? Because technology, I know, is something you're very passionate about as a solution to scaling and access.
Yes, and today, in fact, one of the things that we are suggesting is that the ASHA workers become tech-enabled and tech-savvy.
Right.
Because they are the ones who are going to track, they are the ones who are going to collect data. How do we collect the right data? Right? And how do we use that data to improve our health systems? I think those are some of the issues that we need to talk about. And fundamental to all this is, of course, maternal health and women's health.
And maternal health is a great segue into, one of the statistics that's always shocking to me, that 50% of women are anemic. And when pregnant women are anemic, it's a known fact that it affects the baby, both in terms of IQ, their development, and most women don't even know they're anemic. So again, it comes back to your point of diagnosis. Another statistics that's shocking is mental health, which I know you're very passionate about because you're on the board of a very prestigious organization that I'll let you talk about. But these numbers need to change, Kiran, and we need to do something big to move the needle, I feel.
Anemia, of course, is something that you can definitely diagnose very early. Now comes the next very big thing that you talked about, which is mental health.
Mental health.
Okay. I think mental health is a very, very big area for India to focus on. We kind of brush it under the carpet. Yeah. We almost sort of are in denial that it's a big problem. But I think the pandemic has surfaced this in a big way.
It's been a wake-up call,
right?
No doubt.
And of course, I serve on the board of Live, Love, Laugh Foundation that Deepika Padukone created because of her own interest and experience in mental health. Right. And I think we are really focusing on a lot of areas of basically depression and anxiety, which is really a large part of mental health.
Right.
And these are conditions that can be treated very easily and the health restored.
No, and you spoke about a very important topic that I absolutely want to address today with you, which is the taboos and the stigmas. So you spoke about in the context of mental health, more so in rural, but equally prevalent in urban India. That's there all across, Kiran. I mean, the toughest thing for my show has been to get women to come and speak about their journeys, whether it's abortion, whether it's vasectomy, whether it's contraception, mental health, infertility. We also did a survey with Ipsos on 1,000 women in metro cities with working women, where you would think this would be a lesser of an issue, but 60% of the women don't want to speak about issues because of pressures and stigma and taboos. How do we change this mindset, Kiran?
It's going to be a slow process. I think you need to almost have a movement. In recent times, there have been so many movements where women have started speaking up. Whether it's the Me Too movement, which I think was the biggest movement.
Yes, of course.
And, things like now, like sexual harassment have become very big in terms of awareness, right? Yeah. So, what's wrong with an abortion? I mean, abortions happen for many reasons. And why would women not want to speak about it? Why did they have an abortion? Sometimes it's for medical reasons, and sometimes it's by choice. But we need to talk about it. Why do you, choose to have an abortion for that matter? That becomes a very big topic of discussion. And when women actually start realizing that it's their right, it's their choice, and they've done it for various reasons, and when women realize that they have a right to take such decisions on their own, then only will society accept it as something that can be spoken about.
Right.
If you think about ASHA workers, they're all women. Right? So if you think about the army of health assistants that we have who are women, don't we have that opportunity for these women to make a big difference?
Because they understand other women, and women will feel comfortable talking to them.
And they understand healthcare.
Yes.
And so we need to use ASHA workers much more effectively.
We need to empower them. a lot.
Yeah.
And you know, one of the things, again, it's a personal question, is we're constantly talking about speak up and being more vocal. And I know that you are one of the most outspoken and direct women that I've met. And how does that work out for you? Because I know very often, at least for me, I'm labeled as loud. You know, you probably need to speak a little softer, be a little bit more tactful. Do you hear a lot of that? Do you get judged very often, not just for being outspoken, but for other traits? And, you know, we need to speak about this because I think working women percent has dropped in the last 5 years instead of going up. So how do we get more women in the workforce? And then how do we get more women like you to empower others to speak up?
I think you shouldn't worry about being judged by others.
Yeah.
I think you should judge yourself. So I just speak up because I feel I must speak for not just women, but because I have a voice, I want to speak about things that matter to me.
Right.
Okay? And I think as women, we must speak on things that matter to us. And as far as I am concerned, yes, I would like to see many more women come into the economic mainstream. And you're right that, in fact, instead of seeing it on the rise, we are suddenly seeing a decline.
It's gone from 37% to 27%. I was shocked to hear the female workforce participation.
Yeah, so I think that's a very worrying sign.
Very
I
worrying.
completely agree with you. But I, for one, believe that women do have it in them to be strong, courageous, and then get back into the economic work stream.
But is the corporate culture conducive to their health and the flex hours and the breaks they sometimes need to take for pregnancy and all?
I think corporate culture is improving, not by choice, but out of necessity.
That's also true.
Because I think today the focus through ESG on gender inclusion is so high that if companies don't really focus on creating equal opportunities for women in the workplace, if they don't focus on getting more women into their workforces, they themselves will be at a disadvantage.
So beautifully said, Kiran. I think we've covered a whole gamut of topics. So I just want to leave you with one last question, that being a very, very accomplished woman, again, who feels very strongly about women's health issues and other issues like speaking up, is there one last message that you would want to leave our audience with?
I think gender equity in everything we do is going to be extremely important for the future. And when it comes to health equity, I think women's health is very important to consider in health equity. So those are the kind of messages I want to leave with, since we are talking about women's health.
Absolutely. This is so brilliant. And, you know, it's been an inspiring session. I just want to applaud and publicly acknowledge the incredible job you're doing in inspiring me and so many others. Thanks for being you, the awesome, feisty and fierce Kiran Mazumdar Shaw.
And the feisty Namita Thapar.
अपनी उजली इल्ली ने मन में ठाना है बन के